A patient with hypertension also suffers from gout. Which class of antihypertensive drugs should be avoided in this patient? A. ACE inhibitors. B. Thiazide diuretics. C. Calcium channel blockers. D. Beta blockers. The correct answer is B. Thiazide diuretics can increase uric acid levels, which can exacerbate gout. A patient on a long-term regimen of a certain antihypertensive drug develops a persistent, dry cough. Which drug is most likely responsible? A. Losartan. B. Enalapril. C. Amlodipine. D. Hydrochlorothiazide. The correct answer is B. ACE inhibitors like enalapril are known to cause a dry cough as a side effect due to the buildup of bradykinin. Which of the following antihypertensive drug classes primarily acts by reducing peripheral vascular resistance? A. Diuretics. B. ACE inhibitors. C. Calcium channel blockers. D. Centrally acting agents. The correct answer is C. Calcium channel blockers like amlodipine relax and widen blood vessels by blocking calcium influx into vascular smooth muscle cells, thus reducing peripheral resistance. A diabetic patient with hypertension requires an antihypertensive medication. Which drug class would be the most suitable choice? A. Loop diuretics. B. Beta blockers. C. ACE inhibitors. D. Alpha blockers. The correct answer is C. ACE inhibitors are considered renoprotective and are often preferred in diabetic patients with hypertension as they can delay the progression of diabetic nephropathy. Which antihypertensive drug is contraindicated in a pregnant woman? A. Methyldopa. B. Labetalol. C. Nifedipine. D. Enalapril. The correct answer is D. ACE inhibitors like enalapril are contraindicated in pregnancy due to their potential teratogenic effects. A patient with severe hypertension presents with papilledema. Which drug class is most effective for rapid blood pressure reduction in this emergency? A. Thiazide diuretics. B. Alpha-8 blockers. C. Loop diuretics. D. Direct renin inhibitors. The correct answer is C. Loop diuretics like furosemide provide rapid and potent diuresis, leading to a quick reduction in blood volume and pressure, making them suitable for hypertensive emergencies. A patient with hypertension complains of frequent episodes of dizziness upon standing. Which antihypertensive drug is most likely contributing to this side effect? A. Amlodipine. B. Prazosin. C. Metoprolol. D. Clonidine. The correct answer is B. Alpha-1 blockers like prazosin can cause first-dose postural hypotension, leading to dizziness upon standing. Which of the following drug combinations is an example of synergistic antihypertensive therapy? A. Hydrochlorothiazide and spironolactone. B. Lisinopril and losartan. C. Amlodipine and valsartan. D. Metoprolol and atenolol. The correct answer is C. The combination of a calcium channel blocker, amlodipine, and an ARB, valsartan, offers synergistic blood pressure lowering effects through different mechanisms. A patient with resistant hypertension is prescribed a medication that inhibits the breakdown of bradykinin. Which drug class does this medication belong to? A. ARBs. B. ACE inhibitors. C. Calcium channel blockers. D. Beta blockers. The correct answer is B. ACE inhibitors prevent the breakdown of bradykinin, a potent vasodilator, contributing to their antihypertensive effect. Which antihypertensive drug acts by stimulating alpha-2 adrenergic receptors in the central nervous system? A. Hydralazine. B. Clonidine. C. Minoxidil. D. Nitroprusside. The correct answer is B. Clonidine is a centrally acting alpha-2 agonist that reduces sympathetic outflow, leading to decreased blood pressure. Which of the following is a common side effect of dihydropyridine calcium channel blockers? A. Bradycardia. B. Constipation. C. Ankle edema. D. Dry cough. The correct answer is C. Dihydropyridine calcium channel blockers, such as amlodipine, can cause peripheral vasodilation leading to ankle edema. Which antihypertensive drug class is known to cause hyperkalemia as a potential side effect? A. Thiazide diuretics. B. Loop diuretics. C. ACE inhibitors. D. Calcium channel blockers. The correct answer is C. ACE inhibitors can reduce aldosterone secretion, leading to potassium retention and potentially hyperkalemia. A patient with hypertension and benign prostatic hyperplasia would benefit from which antihypertensive drug class? A. Beta blockers. B. Alpha-8 blockers. C. Calcium channel blockers. D. Central alpha-2 agonists. The correct answer is B. Alpha-1 blockers, such as prazosin or tamsulosin, can relax smooth muscle in the prostate, improving urinary flow in BPH while also lowering blood pressure. Which of the following antihypertensive drugs is a prodrug that requires hepatic metabolism for activation? A. Enalapril. B. Valsartan. C. Amlodipine. D. Hydrochlorothiazide. The correct answer is A. Enalapril is an ACE inhibitor prodrug that is converted to its active form, enalaprilat, in the liver. A patient with hypertension is found to have hyperkalemia. Which antihypertensive drug could be a contributing factor? A. Lisinopril. B. Hydrochlorothiazide. C. Verapamil. D. Clonidine. The correct answer is B. Thiazide diuretics like hydrochlorothiazide can increase potassium excretion in the urine, leading to hyperkalemia. Which antihypertensive drug class is associated with reflex tachycardia as a compensatory response to blood pressure reduction? A. ACE inhibitors. B. ARBs. C. Dihydropyridine calcium channel blockers. D. Central alpha-2 agonists. The correct answer is C. Dihydropyridine calcium channel blockers can trigger a reflex increase in heart rate due to the rapid decrease in blood pressure. A patient on antihypertensive medication develops angioedema. Which drug is most likely responsible? A. Atenolol. B. Losartan. C. Nifedipine. D. Lisinopril. The correct answer is D. Angioedema, a serious allergic reaction characterized by swelling of the face, tongue, and throat, is a rare but potentially life-threatening side effect of ACE inhibitors like lisinopril. Which antihypertensive drug is contraindicated in a patient with asthma? A. Metoprolol. B. Valsartan. C. Amlodipine. D. Hydrochlorothiazide. The correct answer is A. Beta blockers like metoprolol can exacerbate asthma by blocking beta-2 receptors in the lungs, leading to bronchoconstriction. Which antihypertensive drug class is most likely to cause a lupus-like syndrome as a side effect? A. ACE inhibitors. B. Calcium channel blockers. C. Thiazide diuretics. D. Direct vasodilators. The correct answer is D. Hydralazine, a direct vasodilator, is associated with the development of a drug-induced lupus-like syndrome in some patients. Which antihypertensive drug can cause cyanide toxicity in patients with renal insufficiency? A. Sodium nitroprusside. B. Nitroglycerin. C. Hydralazine. D. Minoxidil. The correct answer is A. Sodium nitroprusside is metabolized to cyanide. In patients with renal insufficiency, cyanide clearance is impaired, leading to potential toxicity. A patient with a history of heart failure and hypertension is prescribed a medication that has both antihypertensive and positive inotropic effects. Which drug is being described? A. Digoxin. B. Enalapril. C. Amlodipine. D. Metoprolol. The correct answer is A. Digoxin is a cardiac glycoside that increases cardiac contractility, positive inotropic effect, while also indirectly lowering blood pressure. Which of the following antihypertensive drugs is known to cause hirsutism as a side effect? A. Amlodipine. B. Minoxidil. C. Clonidine. D. Hydrochlorothiazide. The correct answer is B. Minoxidil, a potent vasodilator, can cause hair growth, hirsutism, as a side effect. Which antihypertensive drug class is most likely to worsen symptoms of Raynaud's phenomenon? A. ACE inhibitors. B. Calcium channel blockers. C. Beta blockers. D. Diuretics. The correct answer is C. Beta blockers can worsen vasoconstriction in the extremities, exacerbating symptoms of Raynaud's phenomenon. A patient with hypertension is prescribed a medication that inhibits the conversion of angiotensin I to angiotensin II. This medication belongs to which drug class? A. ARBs. B. ACE inhibitors. C. Direct renin inhibitors. D. Calcium channel blockers. The correct answer is B. ACE inhibitors block the enzyme that converts angiotensin I to angiotensin II, a potent vasoconstrictor. Which antihypertensive drug class is associated with an increased risk of hyperglycemia? A. Beta blockers. B. Thiazide diuretics. C. ACE inhibitors. D. Calcium channel blockers. The correct answer is B. Thiazide diuretics can impair insulin secretion, potentially leading to increased blood sugar levels. A patient with hypertension and a history of depression is prescribed an antihypertensive medication. Shortly after starting the medication, the patient reports worsening depressive symptoms. Which drug class is most likely responsible? A. ACE inhibitors. B. Beta blockers. C. Calcium channel blockers. D. Diuretics. The correct answer is B. Beta blockers, particularly older, non-selective ones, can cross the blood-brain barrier and potentially worsen depressive symptoms in susceptible individuals. Which antihypertensive drug is a potassium-sparing diuretic? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Torsemide. The correct answer is C. Spironolactone is an aldosterone antagonist that prevents potassium loss in the urine, making it a potassium-sparing diuretic. A patient with severe, resistant hypertension is prescribed a medication that acts as a direct vasodilator. Which drug is most likely being considered? A. Hydralazine. B. Losartan. C. Amlodipine. D. Metoprolol. The correct answer is A. Hydralazine is a powerful direct vasodilator that can be used in severe hypertension, often in combination with other antihypertensives. Which antihypertensive drug class can interfere with the metabolism of lithium, leading to lithium toxicity? A. Beta blockers. B. Thiazide diuretics. C. ACE inhibitors. D. Calcium channel blockers. The correct answer is B. Thiazide diuretics can reduce lithium clearance, potentially leading to a buildup of lithium in the body and toxicity. Which of the following antihypertensive drugs is a non-selective beta blocker? A. Metoprolol. B. Atenolol. C. Propanolol. D. Bisoprolol. The correct answer is C. Propranolol blocks both beta-1 and beta-2 adrenergic receptors, making it a non-selective beta blocker. Which antihypertensive drug acts by directly inhibiting the enzyme renin? A. Alaskirin. B. Enalapril. C. Losartan. D. Amlodipine. The correct answer is A. Alaskirin is a direct renin inhibitor that prevents the conversion of angiotensinogen to angiotensin I, the first step in the renin-angiotensin-aldosterone system. Which antihypertensive drug class is associated with a risk of rebound hypertension if abruptly discontinued? A. ACE inhibitors. B. ARBs. C. Beta blockers. D. Calcium channel blockers. The correct answer is C. Sudden discontinuation of beta blockers can lead to rebound hypertension, a rapid and potentially dangerous increase in blood pressure. A patient with hypertension is prescribed a medication that blocks the binding of angiotensin II to its receptor. This medication belongs to which drug class? A. ARBs. B. ACE inhibitors. C. Direct renin inhibitors. D. Calcium channel blockers. The correct answer is A. ARBs, angiotensin II receptor blockers, prevent angiotensin II from binding to its receptor and exerting its vasoconstrictive effects. Which antihypertensive drug is commonly used in the treatment of hypertensive emergencies and is administered intravenously? A. Labetalol. B. Sodium nitroprusside. C. Hydralazine. D. Clonidine. The correct answer is B. Sodium nitroprusside is a potent, rapidly acting vasodilator used for rapid blood pressure control in hypertensive emergencies. Which of the following antihypertensive drugs has a unique mechanism of action involving the opening of potassium channels in vascular smooth muscle? A. Minoxidil. B. Hydralazine. C. Diazoxide. D. Nitroprusside. The correct answer is A. Minoxidil activates potassium channels in vascular smooth muscle cells, leading to hyperpolarization and relaxation, resulting in vasodilation. Which antihypertensive drug class is considered first-line therapy for patients with hypertension and chronic kidney disease? A. Beta blockers. B. ACE inhibitors. C. Calcium channel blockers. D. Diuretics. The correct answer is B. ACE inhibitors are often preferred for patients with hypertension and CKD due to their renoprotective effects, slowing the progression of kidney damage. A patient with uncontrolled hypertension develops severe headaches and blurred vision. Which antihypertensive drug class is most appropriate for immediate blood pressure control in this situation? A. Thiazide diuretics. B. Loop diuretics. C. Direct renin inhibitors. D. Central alpha-2 agonists. The correct answer is B. Loop diuretics, like furosemide, are highly effective for rapid blood pressure reduction in hypertensive emergencies due to their potent diuretic action. Which of the following antihypertensive drugs has a short duration of action and is often used as an intravenous infusion for controlled blood pressure lowering in hospitalized patients? A. Nitroglycerin. B. Sodium nitroprusside. C. Hydralazine. D. Minoxidil. The correct answer is B. Sodium nitroprusside has a short half-life and requires continuous intravenous infusion for sustained blood pressure control in critical care settings. Which antihypertensive drug can cause a positive Coombs test as a potential side effect? A. Methyldopa. B. Labetalol. C. Nifedipine. D. Enalapril. The correct answer is A. Methyldopa, a centrally acting alpha-2 agonist, can cause a positive Coombs test an autoimmune reaction affecting red blood cells. A patient on antihypertensive medication develops gynecomastia. Which drug is most likely responsible for this side effect? A. Spironolactone. B. Amlodipine. C. Metoprolol. D. Lisinopril. The correct answer is A. Spironolactone, a potassium-sparing diuretic and aldosterone antagonist, can cause hormonal imbalances leading to gynecomastia, breast enlargement in males, in some patients. Which antihypertensive drug class is commonly used in combination with other antihypertensive agents to enhance blood pressure control and reduce side effects? A. Thiazide diuretics. B. Loop diuretics. C. Direct renin inhibitors. D. Central alpha-2 agonists. The correct answer is A. Thiazide diuretics are frequently used in combination with other antihypertensive drugs to achieve better blood pressure control and minimize the need for high doses of individual medications, reducing side effects. Which antihypertensive drug can cause a metallic taste in the mouth as a potential side effect? A. Captopril. B. Losartan. C. Amlodipine. D. Metoprolol. The correct answer is A. Captopril, an ACE inhibitor, is known to cause taste disturbances, including a metallic taste, as a side effect. Which antihypertensive drug class is considered relatively safe and effective for use in elderly patients with hypertension? A. Thiazide diuretics. B. Alpha-8 blockers. C. Calcium channel blockers. D. Central alpha-2 agonists. The correct answer is C. Calcium channel blockers, especially long-acting dihydropyridine calcium channel blockers like amlodipine, are generally well tolerated and effective in elderly hypertensive patients. Which antihypertensive drug is contraindicated in patients with bilateral renal artery stenosis? A. Metoprolol. B. Hydrochlorothiazide. C. Enalapril. D. Amlodipine. The correct answer is C. ACE inhibitors can significantly worsen renal function in patients with bilateral renal artery stenosis by reducing glomerular filtration pressure. Which antihypertensive drug can potentiate the effects of neuromuscular blocking agents used during surgery? A. Dantrolene. B. Succinylcholine. C. Vecuronium. D. Pancuronium. The correct answer is A. Dantrolene, a muscle relaxant used to treat malignant hyperthermia, can enhance the effects of neuromuscular blocking agents, increasing the risk of respiratory complications during surgery.